Okay. Hi, my name is Abby. I'm your nurse for today to the hand hygiene. I'm here to do a head-to-toe assessment because there's an order from your doctor to do a head-to assessment. Is it okay with you?
Yes.
Okay, may I know your date of time? May I know your name and your date of birth?
Maricris Lilian, April 13, 1994.
Okay, I'll just provide privacy. Can I just check with your band? Okay, I have the correct patient and on the patient's file. So, do you have any pain? Do you experience any pain today?
Yes, in my arm.
Okay, so you have a pain on your arms. May I know, do you know what triggers or provoke the pain?
When I flex and extend it,
Can you describe the pain?
it's aching pain.
Okay, is it radiating to the other location on your body?
To my shoulder.
To your shoulder. And if you want to rate the pain, can you rate it from 1 to 10?
6.
6. And may I know when does the pain started?
Last night after exercise.
It is come and go or it's constant?
Comes and goes.
Comes and go. And do you think what causes the pain?
Because I did not stretch, that's why I think it hurts.
Okay, okay. Now I will also assess your level of consciousness. Can I have again your name and date of birth?
Maricris Lilian, April 13, 1994.
Do you know where you are?
I'm in Sunnybrook Hospital.
Do you know the time and date today?
It's 5 p.m. July 5, 2023.
And do you know who's the Prime Minister of our country?
Justin Trudeau.
Okay, so the patient is aware, the speech is clear, and the mental status is awake and appropriate. The patient is oriented also to place, time, and current events. Now I'm going to check your eyes. Okay, by looking at your eyes, the sclera is shiny and white. The pupil is round and dilated. I'll just check here. And the conjunctiva is pink and there's no discharge. So I'm also gonna assess your cranial nerve, 3, 4, and 6, the oculomotor, trochlear, abducent, and also your facial nerve. Okay, so now just look at me, don't move, just look at my finger, follow this, here, 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 here. So no stagnus noted, and you can just stare at the wall. And I'll also check cover your one eye. Okay. Other one. Okay, so the pupils are perfectly round and 3 to 5 millimeters reactive to light, and just stare on the wall. Just look at my finger. Okay, and can accommodate. Can you cover your eyes? Can you see this?
Yes.
Can you see this?
Yeah.
Can you see this?
Yes.
Can you do it on the other side? Can you see this?
Yes.
Can you see this?
Yes.
Can you see this?
Yes.
Okay, so the patient vision, there's no abnormalities. The peripheral vision of the patient can count the fingers on equal quadrant both eyes. Now I will assess your facial nerve. So can you smile? Raise your brows. Purse your lip. Blow your cheek. So also the patient can do it with ease, and cranial nerve 7 is intact. So now I also do your respiratory rate. So do you have any history of respiratory problem like asthma, emphysema, bronchitis?
No.
Are you smoking?
No.
So can you just inhale, exhale? Because I will look for the expansion and retraction of the chest wall. Okay, inhale, exhale. Okay. I'll also put my camera at your back. Just inhale, exhale normally. Okay. Inhale, exhale. So by putting my thumb at the back, I can see the chest expand symmetrically, and yeah, inhale, exhale normally. Now I will auscultate your lungs. Inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. Okay, I will do it also at your back. Inhale, exhale, 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 inhale, exhale. So the finding is there's no respiratory restraint, no adventitious sound present. It's regular, non-labored breathing. The chest is symmetrically to anterior and posterior chest wall, and the respiratory rate is 18 breaths per minute. So I will also continue to do your cardiac assessment. So for cardiac assessment, I also need to ask you if you have any history of hypertension on your family, or if you're taking any heart medication, or if you have any heart problems.
No.
No. So I'll auscultate the location. Okay, this is the auscultating, and this is the aortic area. It's in the second intercostal space along the right sternal border. This is the pulmonic area, second intercostal space at the left side external border. This is the Erb's point. Left third intercostal space, and the next one will be the tricuspid area, fourth to fifth intercostal space along with the left external border. And this is the mitral area, fifth intercostal space, near mid-clavicular, and I will listen to it 30 seconds. Okay, the heart rate is 86 beats per minute, and there's no murmur, no adventitious sound present, normal lub-dub sound. And I will assess your abdominal, okay? May I know when is the last time you voided?
2 hours ago.
How about the bowel movement?
This morning.
This morning, okay? Can you lay down? Okay, I'll just check I'll just raise your shirt, okay? So by looking at it, so the skin color and distribution looks normal. There's no lumps, there's no bumps, and there's no obvious bumps, and there's no scars or surgical, and the abdomen is flat, symmetrical with no bulging or swelling of the umbilicus. The skin is intact abdomen. So now I will auscultate the 4 quadrants of the abdomen. I will start from the right lower quadrant, upper right quadrant, left upper quadrant, left lower quadrant. Now I will also use the bell of my stethoscope to auscultate the vowel sound. Now I will continue to palpate your abdomen. Just tell me if you feel some pain. I will just use now a light pressure on it, okay? Is there any pain?
No.
How about this?
No.
How about this?
None.
This one?
None.
Okay, I will just add a little pressure in it, okay? How about this?
None.
This one?
No.
This one?
No.
This one?
No.
So my findings is normal bowel sound, no tenderness, no pain, and no mass for her abdomen. So I will also now assess for your extremities and integumentary skin, okay?
Okay.
Do you have any skin cancer in your family?
No.
Do you do tanning?
No.
Do you use SPF or sunscreen where you go out or exposed to the sun?
Yes.
Okay, good. So now I'm expecting the upper and lower extremities now. So the color is appropriate for the ethnicity, and by slightly palpating the skin, I can feel that it's warm, smooth, and dry, and intact. So the skin hair, that it's a normal hair distribution, no obvious lesion, bruises, edema, or deformities. Okay, so now I'm gonna check your skin turgor. Okay, so I'll just pinch your skin and I can see that there's no, it's well dehydrated, normal skin turgor, and no denting. Okay, can I remove your socks?
Yes.
Okay, so I will also assess your fingers. Okay, so the fingers. So the fingers are neatly trimmed, pink in color, no clubbing, and the capillary reflex is less than 3 seconds. Now I'm also gonna check your bilateral pulses. So your bilateral pulse are +3, equal, normal, and the quality is non-bounding, and the pulse is 85 beats also per minute. And I will also check on your dorsal. Okay, it's +3 bilaterally in your dorsal. This is the dorsal peris, and I will also check your posterior tibia. So it's also +3 bilaterally. Okay, so both pedal pulses are present and palpable. Now I'm gonna assess your range of motion. Okay, so please, can you copy what I'm doing? Okay, I'm just checking round. Can you grip my hand? Squeeze it. It's very hard. Okay, good. Now, Can you push my arms? Okay, how about your feet? Can you push? Okay, good. So the resistance is good. It's plus 5 normal strength. And while checking your range of motion, fingers and legs are all positive vibe, and there's a resistance. Now, I'm already done with your head-to-toe assessment, hand hygiene, and document and record the report of the assessment findings. Thank you.